FM 95.4.
Let's talk.
Live on TFM and the TFM Facebook page. This is the live feed of TTV. Let's talk.
Hello and welcome to The Outline. Coming up are the headlines for the day. OCCI issues advisory on harmful practices. VAT to add 1.5% to Oman's GDP. Pandemic taking toll on psychological wellness. Those are the headlines for today. On our show today, we also have our very special segment Fighting COVID with Madiha Asif. But first, the fact for the day. The sun will eventually be the size of the earth. Once the sun has completed its red giant phase, it will collapse. Its huge mass, however, will be retained, but will have a volume similar to that of Earth. When that happens, it will be known as a white dwarf. That was our fact for today. Now let's take a look at the weather report from Oman Meteorology and Civil Aviation Authority. An alert has been issued indicating poor visibility during fog formation. Apart from that, we've got mainly clear skies over most of the Sultanate, with chances of cloud formation over the Al Hajar Mountains during the afternoon. There are also chances of late night and early morning low-level clouds or fog patches over parts of the Oman Sea coast and also over parts of South Al-Sharqiya, Al-Wusta and Dhofar. With that, let's take a look at what the weather will be like throughout the Sultanate. Muscat will be sunny with temperatures between 24 and 31 degrees Celsius. Musandam will also be sunny with temperatures between 16 and 25 degrees Celsius. North Al-Batana will be sunny with temperatures between 21 and 28 degrees Celsius. And Southern Batana will also be sunny with temperatures between 19 and 30 degrees Celsius. Al-Buremi will be sunny with temperatures between 17 and 33 degrees Celsius. Al-Dahira will be sunny with temperatures between 21 and 33 degrees Celsius. Al-Dakhla will be sunny with temperatures between 22 and 33 degrees Celsius. North Al-Sharqiya will be sunny with temperatures between 20 and 33 degrees Celsius. And South Al-Sharqiya will also be sunny with temperatures between 26 and 34 degrees Celsius. Al-Wusta will be sunny with temperatures between 19 and 36 degrees Celsius. And Dhofar will be sunny with temperatures between 18 and 26 degrees Celsius.
Oman's largest online supermarket now has no minimum order limit. From grocery to household items, Rafiq has everything that you want. Enjoy worry-free shopping with over 8,000 products to choose from and get it delivered straight to your doorstep. Rafiq, you order, we deliver.
Welcome back to Outline. Let's go over the local stories for the day. The Oman Chamber of Commerce and Industry has informed business owners about the most harmful practices in international trade regarding dumping, subsidy and increase in imports. OCCI said in a statement the following. With reference to the increasing cases of harmful practices in international trade, that is dumping, subsidy and increase in imports, raised by foreign imports against Gulf exports, which was matched by an increase in complaints submitted by the Gulf industry against foreign imports, Royal Decree No. 20 by 2015 was issued adopting the law, the Unified System for Combating Dumping and Countervailing and Preventive Measures for the Countries of the Gulf Cooperation Council because of its special importance for their domestic industry. It provides protection against harmful practices in international trade represented in dumping, subsidy and increase in imports which may cause or threaten to harm the local industry or hinder the establishment of industries. While value-added tax or VAT is expected to come into effect in Oman on April 16, 2021, a number of goods and services have been granted exemption. VAT is expected to contribute about 400 million Omani riyals to the economy every year, about 1.5% of the country's GDP, and with about a month left before VAT is brought in, the regulations regarding how the tax will be collected have been issued. Saud Nasir Al-Shukeli, chairman of the Tax Authority, on Sunday issued decision number 53 by 2021, promulgating VAT laws executive regulation based on the provisions of Royal Decree number 121 by 2020 on VAT law. The regulations include all of the procedures concerning bringing the provisions of the VAT law into effect, such as procedures for payment, registration and collection of the tax, and for raising objections or concerns with regards to tax imposed. All of the necessary preparations and requirements for the value-added tax, which has been scheduled to be implemented on 16th April, have been completed, said Al-Shukeli. Issues relating to taxation, such as the laws and executive regulations, preparing the necessary computer equipment, setting up online links to the bodies that govern taxation in Oman, and providing training on VAT to the workers of the tax authority are some of the measures that have been enacted ahead of the arrival of VAT. Guidance manuals have been drafted for some sectors, workshops and panel discussions have been organized to spread awareness, and instructions on how to register for VAT have also been issued. VAT working groups have been formed across a number of sectors, including oil and gas, finances, and telecommunications. Companies which are required to register for VAT have also been given sufficient time to update their accounting systems and other operations so that they comply with the new regulations. Some 93 essential commodities will be subject to zero-rate taxation. Goods services included under zero tax are basic food supplies, medical care and related items, education services and supplies, financial services, undeveloped lands, resold residential real estate, transport services, residential homes for rent, medicines and medical equipment, investing in gold, silver and platinum, international transport operations and related services, sale of search and rescue planes and boats, crude oil and its derivatives, commercial sea, air and land transport operations and related services, assistance provided to people with disability and receiving therapy. People are taking up unhealthy habits such as comfort eating and panic buying to escape from the impact COVID-19 has had on their mental health in the form of stress, depression, trouble sleeping and anxiety, says doctors in the country. One among three of the 1,580 locals and expatriates surveyed to examine the impact of COVID-19 and the measures taken to limit its spread are shown to suffer from these symptoms. According to Dr. Badr bin Ali Al-Habsi, the director of Al-Masara Hospital, the psychological factors of COVID-19 on people's well-being cannot be ignored. We have seen that cases of anxiety and depression, which are consistent with post-traumatic stress disorder, have gone up from 48% to 51% of people, he said. The impact of the virus on isolated and infected people is one of the most important matters to highlight. Adding to this, Dr. H. Hamid bin Nasir Al-Sinawi, a senior consultant in behavioral medicine at Sultan Qaboos University Hospital, said people who have good mental health are more likely to be more resistant to the virus because of the effect a positive mentality has on people's physical well-being. Among the consequences that we saw, primarily due to the closure of stores, was concerning behaviors such as panic buying of essential goods and hoarding foodstuff, he explained. Some people also suffer from obsessive-compulsive disorders such as excessively washing their hands, avoiding contact with others, and refusing to leave home even when movement restrictions were not in place. Dr. Nada bint Abdullah Al-Balushi, a specialist physician at Al-Masara, explained that women under the age of 40 are more prone to mental disorders because of the nature of the female gender, which makes women in general more vulnerable to depression and anxiety. Those are the local stories. Now for some COVID-19 updates. The Ministry of Health has registered one new death due to COVID-19, taking the total death toll in the Sultan to 1,609. The ministry has extended its deepest condolences to the families of the deceased. The Ministry of Health has also announced the registration of 556 new COVID-19 cases, taking the total cases in the Sultan to 147,423. In the past 24 hours, there have been 341 recoveries, and the total number of recoveries now stand at 136,770. The ministry has urged everyone to adhere to social distancing instructions issued by the Supreme Committee and the Ministry of Health. Those with the COVID-19 update. Now let's head to the Fighting COVID studio with Madiha Asif.
Thank you, Antara, for the updates and welcome to Fighting COVID. It really comes as a shock, seeing the number of coronavirus cases constantly increasing since the last month now, maybe more than a month now, that we had Dr. Prakash from Ministry of Health, and he was telling that it has been noted since January, mid-January, the numbers are again on the rise. And today, with Antara just telling us about the COVID cases, which has crossed 500 mark, it really comes as a shock. It shows that people are still not adhering to the precautionary measures issued by the Ministry of Health and Supreme Committee, and also people who are eligible for vaccine, please step forward and go get vaccinated for your sake and for the sake of others who could be at risk of getting infected. Having said that, today's episode is going to be a bit different because previously we have been talking about how coronavirus infects those who are at risk, those with chronic illnesses, those with diabetes, obesity, and so on. So before we were only focusing on how it affects people with internal issues and internal health problems. Today we are going to be focusing on how it affects people on the outside. And for that purpose, we have Dr. Mona Negm, who's specialist of dermatology, cosmetology, and laser, as well as a member of European Academy of Dermatology and Venereology, talking about how COVID has a relation with skin infections. Thank you so much, Dr. Mona, for joining us today. Dr. Mona, can you hear me? I think, Dr. Mona, we are having some issues hearing you right now. We'll try to fix that issue. And in the meantime, I remember that talking to Dr. Prakash and other health officials who came to our show previously, they were talking about how COVID-19 is affecting the daily lives of those who are not adhering to the precautionary measures. And because of the increasing cases and people not adhering to these measures, the closure is coming now and then in the Sultanate. As we all know that we're still in the middle of the commercial activities closure that starts from 8 p.m. and continues until 5 a.m., which started on 4th March and is going to continue until 20th March. Now, looking at the cases and looking at the increasing number of coronavirus, we can speculate or assume that either the lockdown, most likely going to continue, or the Supreme Committee or the Ministry of Health is going to come up with more solid measures to curb and help curb the spread of the virus in the country. But I remember that, no matter how many rules and regulations the ministry and the authorities are putting in, unless we don't take the responsibility, unless we don't take it seriously, it's going to be really difficult for the authorities in the country to help control the virus. And you all know that the new variant is also making headlines across the globe, and 6 cases were also registered in the Sultanate. And the officials are doing their best to control all these things. And we have Dr. Mona back online with us. Dr. Mona, can you hear?
Yes, I can. You hear? Yeah.
Okay, finally. Welcome to the show.
Hi, how are you?
Great. How are you doing? Thank you so much for joining us today.
Hi. Thank you. Thank you.
So, Dr. Mona, I was just telling the viewers that we have been talking only about those with internal issues and internal problems, health issues. How does coronavirus link with dermatology?
Actually, it has a strong connection. A lot of people who got infected with COVID-19 got also a skin manifestation even during the infection or after recovery. Also, some treatment we are giving for some dermatological diseases is that this kind of immunosuppressive therapy can affect the immunity, so it can also make people more liable to get infected with COVID-19. So it really has good relation between both. Strong relation, yes.
Right. Not a lot of people actually think that, skin would have any kind of relation with coronavirus because everyone is worried about their internal health more. Now, talking about coronavirus and dermatology, what kind of skin infections or what kind of diseases people are prone to?
A lot of skin manifestations happen ranging from simple diseases like just macule or just simple urticaria to vesicle eruption all over the body. A lot of people also got something called livedo reticular and also chilblains for periphery. Now it's called COVID-19 too. Because of affection of periphery, yes.
Have you, in your experience, seen like people who get infected with coronavirus are getting any skin infection or skin-related issues that you're currently treating?
Actually, yes, I'm seeing daily in my clinic. Not this kind of skin rash, but also that acne appearing because of mask or hand eczema. I'm seeing daily in my clinic.
I was just going to ask you, Dr. Mona, about people, a lot of people are complaining about when they wear the mask, they get these skin marks or rashes or acne, or with the PPE. A lot of people think that, this is just a reason for not to cover their face, or they are, finding an excuse not to cover. But is this actually a problem that people are facing?
This is a daily complaint in my clinic. Even it happened to me before. The problem is we have to wear a mask all the time. So sometimes we have allergy from that mask. Sometimes people who had oily skin, sebum accumulate under the skin and easily cause acne. A lot of people now using same mask all the day. So we have to change it regularly to get rid of that acne. Now it's called as a mascan because it's really become famous. They called as a mascan. So if we got that acne, we have to seek rapidly medical advice to treat it early. Also for hand eczema, I'm seeing daily in clinic. Sometimes it becomes very severe and causing fissure. This is really horrible for people who are using sanitizer mixing, for example, alcohol with chlor because they are obsessed by using too much hand cleaning.
Okay, so you're saying like people who are using too much alcohol or alcohol rub on their hand and they're touching their face, it's also causing issue.
Yeah, it could happen, yes, of course.
Right. So, Doctor, you just mentioned about the mask, about the changing of mask. Can you tell us a little about when you wear these reusable masks or when you wear these disposable masks? What exactly is the time period? What's their, lifespan for these masks?
Okay. Normally, if your mask is clean, okay, you can use it. But if you will use for a long time, it's better if you can change it every 4 hours. If you have to wear it for a long time, you have to make good aeration for this area. You have to remove it at least 15 minutes every 2 hours to give your skin good aeration. This is very important. And if you have allergy from this type of mask, you have to change it to other type of mask. This is also very important because some type of mask have like a synthetic material, so it can easily cause irritation for your skin. And also you have to use some moisturizers, some night peeling to get rid of excessive sebum.
Doctor, talking about the problems that is causing people because of wearing mask, what do you suggest them? Do you suggest them to change to a particular type of mask to avoid this kind of problem, or people with sensitive skin?
Yeah, if you are, normally you are using our surgical mask. But if you have allergy from this, you can just use the cotton one, so it's good. But also you need to change it and clean it regularly.
Right. Thank you so much, Dr. Mona. We're just going to take a quick commercial break, but you all stay tuned as we're still in conversation with Dr. Mona.
Oman's largest online supermarket now has no minimum order limit. From grocery to household items, Rafiq has everything that you want. Enjoy worry-free shopping with over 8,000 products to choose from and get it delivered straight to your doorstep. Rafiq, you order, we deliver.
Welcome back to TTV. You're watching Fighting COVID, and in conversation we have Dr. Mona with us, who's talking about how dermatology is correlated with coronavirus. Dr. Mona, before going on a commercial break, we were talking about masks, but there are also cases that has been reported. People who actually had dermal fillers, they had swelling in their lips and in their face after getting the coronavirus vaccination. Can you tell us a little about it?
Yeah, this is our daily or frequent asking question in clinic. There's one study they did on people, but really this study was in small population, so I can't say it's accurate. But normally, filler can cause allergy for anyone. Of course, it's not common, but it could happen. If it's happened, don't be panicked. Just we will treat it like normal allergy. But in my opinion, or my advice for people who will do filler or any kind of treatment for skin, it's better to give 2 weeks apart between treatment and vaccine, just to be in safe side to avoid any reaction could happen. And if you see any reaction, just please seek rapid medical advice to treat it as early as possible. Don't worry, it's easy, we can treat it.
Right. Dr. Mona, earlier in the show, you also mentioned about chilblains lesions, which is actually coronavirus tosa, if I'm not wrong. There is a lot of ambiguity and confusion going on among the dermatologists about this disease. Can you explain us what exactly is happening and why is there so much confusion and ambiguity?
Okay, normally corona or COVID-19 is a virus, and virus easily causes vasculitis. What is vasculitis? Is inflammations of vessels. It's happened for all your systems. That's why COVID is really dangerous. Also, it can happen in your peripheral blood vessels. So it easily can cause a chill pains. Chill pains is like what you get in your periphery, like swelling, changing in color. Sometimes ulcers could happen. Okay, we are treating as normal chill pains, but virus can cause this, yes, because it can cause vasculitis. So it's happening really.
Is this something commonly happening in the Sultanate? Are you seeing this kind of symptoms in your
I
patients in
don't,
Oman
no,
too?
here I didn't see, yeah, here I didn't see too much patient, but it's really reported. Yani, over worldwide it's reported, but here I didn't see too much, alhamdulillah.
Well, that's a good news. If you're not seeing such cases, then I'm sure it's good so far.
Alhamdulillah.
Dr. Mona, now you have been practicing, for quite some time, and we have been in this pandemic since last year. Have you seen any cases of coronavirus people who have been infected or post-COVID complaining about any skin manifestations?
Yes, I saw after recovery they got some skin rashes and some vasculitis also in, يعني in some areas in face. Some purpuric eruption also happened.